So much, Mr. President. Dr. Fauci said earlier this week that the lag in testing was in fact a failing. Do you take responsibility for that? And when can you guarantee that every single American who needs a test will be able to have a test? What's the date of that?
Yeah, no, I don't take responsibility at all because we were given a set of circumstances and we were given rules, regulations, and specifications from a different time. Wasn't meant for this kind of an event with the kind of numbers that we're talking about. And what we've done is redesigned it very quickly with the help of the people behind me. And we're now in very, very strong shape. I think we'll be announcing, as I said, Sunday night. And this will start very quickly. And we'll have the ability to do in the millions over a very, very quick period of time. So no, and what we have done, and we are going to be leaving a very indelible print for the future in case something like this happens again. But it was and that's not the fault of anybody, and frankly, the old system worked very well for smaller numbers, much smaller numbers, but not for these kind of numbers. Tony, maybe you'd like to say something?
Will you have,
Tony,
yes, please, by Sunday night, will every American be able to get a test?
So just to reiterate what I said to many of you multiple times, it's a distance of a system. The system was not designed for what it was designed for. It worked very well. CDC designed a good system. If you want to get the kind of blanket testing and availability that anybody can get it, or you could even do surveillance to find out what the penetrance is, you have to embrace the private sector. And this is exactly what you're seeing, because you can't do it without it. So when I said that, I meant the system was not designed for what we need. Now, looking forward, the system will take care of it.
And Mr. President,
And
with respect,
interestingly, if you go back, please, if you go back to the swine flu, it was nothing like this. They didn't do testing like this, and actually they lost approximately 14,000 people, and they didn't do the testing. They started thinking about testing when it was far too late. What we've done, and one of the reasons I think people are respecting what we've done it very early. We've gotten it very early, and we've also kept a lot of people out.
Mr. President,
yes,
the
please,
last
go ahead.
administration
Please.
said that they had tested 1 million people at this point. You've been
Well, ask them
president
how they
for
did with the
3 years.
swine flu. It was a
But
disaster.
with respect, you've been
Next,
president
please.
for 3 years.
Next,
and you've been
please.
calmly suffering.
They had a very big failure with swine flu. Very big failure. Please, go ahead.
Thank you so much, Mr. President. I want to know if you are in contact with the Brazilian President Bolsonaro after a member of his delegation who was with you Saturday was tested positive. And also, I want to ask another question, if you let me. Senators Lindsey Graham and also Senator Rick Scott are self-isolating. Are you planning to take any kind of precautionary measure to protect you and also your staff who was there?
No,
With him?
we have no symptoms whatsoever, and we had a great meeting with the president of Brazil, Bolsonaro, great guy, very tremendous. He's doing a fantastic job for Brazil, and as you know, he tested negative, meaning nothing wrong this morning, and we got that word too, because we did have dinner with him. We were sitting next to each other for a long period of time.
But are you in contact with him over the coronavirus crisis?
We're talking about it country to country, but we did discuss if he had a problem. It was reported that he may have it, and he doesn't, fortunately. Yes.
Thank you, sir. With regard to domestic travel, should Americans feel safe, or should Americans at all be traveling to states such as Washington State, New York, and other hotspots within this country? And a follow-up on Brazil, you're asking people who come back from Europe, Americans who are coming back from Europe, to self-quarantine for a couple of weeks. You were in a picture with somebody who now has coronavirus from Brazil at Mar-a-Lago. How is that different?
Well, I'll tell you, first of all, I'm not coming back from someplace.
But you were exposed.
There was somebody that they say has it. I have no idea who he is, but I take pictures and it lasts for literally seconds. I don't know the gentleman that we're talking about. I have no idea who he is. I haven't seen the picture. I said there's a picture of somebody, but I take sometimes hundreds of pictures a day. And that night I was taking hundreds of pictures, so I just don't know. Now, I did sit with the president for probably 2 hours, but he's tested negative, so that's good.
It's just a matter of...
Please, go ahead.
And the domestic...
Go ahead, please. I would say if you stay home, it's not bad. it's not bad. Now, there are certain parts of the country that are essentially have zero problem. Washington's been very tough, in particular a nursing home. But Washington, the state of Washington's been very tough. It's been a big percentage of, when you talk about the 40 deaths, it's been a big percentage of the deaths, as you know very well. And they all came from a certain area, unfortunately. Please, go ahead. Go ahead, please.
Mr. President, thank you. I want to first follow up on Jeff's question, because the person you were standing next to, whether you know who he is or not, tested positive for coronavirus. Dr. Fauci said this morning, if you stand next to somebody who tested positive, you should self-isolate and get a test. You say your White House doctor is telling you something different. Who should Americans listen to? And my second question
I think they have to listen to their doctors. And I think they shouldn't be jumping to get the test unless it's necessary. But I think they have to listen to their doctors. And I mean, I don't know, I haven't seen the picture. Somebody said there's a picture with somebody taking a picture with me, but I haven't seen it.
Well, doctors have
But
said
I
you
can
might
tell
have
you-
it even if you don't have symptoms. Are you being selfish by not getting tested and potentially
Well, I didn't say I
exposing-
wasn't going to be tested.
Are you going to be?
Most likely, yeah. Most
When do you
likely.
think
Not for
that'll
that
happen?
reason, but because I think I will do it anyway.
Will you let us know
Fairly
the
soon. We're
results?
working on that. We're working out a schedule.
My second question, Mr.
You go
President,
ahead,
that was
please.
a follow-up.
Go ahead. Yeah.
My second question, Mr.
You go
President,
ahead,
that was
please.
a follow-up.
Go ahead. Yeah.
I know there's been a lot of talk about testing. I just want to make sure we're clear, though, because we've been hearing from doctors who say, as of today, they still can't get patients tested who need a test. So as of today, can everyone who a doctor wants to have tested get tested? And if not, when?
Well,
When
that's
will
been
doctors
true for a
do it?
while, but I'll let Mike, why don't you answer that, Mike?
Well, as the President said, and Dr. Fauci has articulated, the nature of our current system where the CDC has samples sent and tests are performed, or state labs perform tests, or in some cases university and hospital labs perform tests, is generally adequate for an infectious disease or for people getting a diagnostic work done. But given the sheer scale of this, the President tasked us with bringing together this extraordinary public and private partnership. Today, by some estimates, when you add all the labs together, and today the President made it possible for every state in the country and their state labs